You have cancer, and you start looking for a treatment. New experimental treatments come in every month, and you submit them to your insurance company. They deny each treatment with comments like non-medical necessity or not for this type of cancer. Then you find a treatment that is proven to work in many cases, bone marrow transplant. Yet your healthcare insurance provider once again denies payment for your treatment and says this one is experimental. Things like this happen all over the United States. Privatized healthcare companies shut down patients in need left and right with no discretion. Today, I would like to show you a different solution, socialized healthcare. Socialized healthcare is used in countries like Canada, Britain, and France. I will show you the differences between privatized healthcare versus socialized healthcare, tell you two stories from the movie Sicko, and statistics of healthcare programs comparative to the United States. First, let's take a look at the differences between privatized and socialized healthcare. Privatized healthcare is what we have in the United States today. I'm sure you all know that. Healthcare system is ran by a multi-million-dollar company in which you pay deductible and then a monthly fee. The problem with privatized healthcare is that it's ran like a business. Medical reviewers at companies such as Blue Shield, for example, try to save money for the company by excluding patients of costly treatments as much as possible through corrupt means. Not only is this wrong, they are also rewarded for it by a type of commission for saving the company money. In May 30th, 1996, Linda Pino, a former medical reviewer at Humana, made a public confession before Congress. In her testimony, she said, "My name is Linda Pino, and I'm here primarily today to make a public confession. In the spring of 1987, as a physician, I denied a man a necessary operation that would have saved his life and thus caused his death. No person and no group has held me accountable for this because, in fact, what I did was save the company $500,000, and furthermore, this particular act secured my reputation as a good medical director and ensured my continued advancement in the healthcare field. I went from making $100 a week as a medical reviewer to an escalating six-figure income as a physician executive." You can find this clip on YouTube or in Michael Moore's documentary Sicko. Now let's talk about socialized healthcare. Socialized healthcare is used in many countries around the world, including Canada and most of Europe. Citizens pay taxes to the government, and in turn, the government puts out a free universal healthcare. All treatments are free, and medicine is free, or close to being free, depending on what country it is. Doctors are also paid for by the government. According to the National Health Service's website, a British general practitioner, which is like a doctor, earns anywhere from £53,000 to £81,000 a year. So this doesn't say that the doctors over in Britain are unqualified because it's a free healthcare system. They're actually pretty qualified and make a really nice income. Next, I'd like to share you two stories from the documentary Sicko. First, let's talk about Alexei Krumov's story. He spent most of his life in the United States, but had no health insurance in the States, so when he found out he had a tumor, he was forced to move back to France. Alexei left France to the States when he was 18, so he never got paid, or he never paid any taxes, nor did he even have a social security number. To the hospital, it seemed like he was broke, but they gave him treatment anyway. He was treated with 3 months of intense chemotherapy, and when asked if he was ready to go to work, he declined and said he wasn't ready. He was given 3 months off of work, which was also paid. 65% of his wage was paid by the government, and 35% was paid by his employer. Next, let's look at Reggie Cervantes. Reggie Cervantes was a volunteered emergency technician on 9/11. Her airways were burned during the day at Ground Zero, and now she has trouble breathing and catching her breath. In the documentary, Michael Moore and a group of 9/11 volunteers takes her and a group of 9/11 volunteers to Cuba, another country with universal health care. Moore took Reggie to a local pharmacy where she found that her medication for her breathing problem was only 3.2 pesos, which is something like 5 cents in the States. In the United States, her medication costs $120. Lastly, there are statistics that show that privatized healthcare does not improve a state's standard of living, and therefore fails as a healthcare system. Here are some statistics from the OECD health data chart that surveys the entire world. All these statistics are from 2007. In life expectancy average, the U.S.'s average was 77.9 years, while Germany's was 80, France was 80.9, and Norway 80.5. In professionally active positions per 1,000 people, the U.S. was at 2.57 per 1,000, while France was at 3.35, Germany at 3.83, and Denmark at 3.67. Now let's see the total expenditure on health according to the percentage of GDP, or gross domestic product. The U.S. spends 15.7% on GDP on healthcare. However, Germany only spent 10.4%, Norway 8.9%, and the United Kingdom at 8.4%. Not only does the United States spend the most on healthcare, but it loses to most European countries in terms of health statistics. Furthermore, according to the HDI, or Human Development Index, in 2007 the U.S. ranked 12th on their listings, with Norway ranking first. Since most European countries use a universal healthcare system, this proves that universal or socialized healthcare systems are better than privatized healthcare systems. Today, I've talked to you about what privatized and social healthcare is, shown you 2 stories from the documentary Sicko concerning healthcare, and given you some statistics. Hopefully this has enlightened you about the healthcare system and brightened your worldview. Socialized healthcare is for our benefit, and it's up to us to make it happen. Thank you.
So Vanessa, what did you think?
I like that he gave personal stories about, not personal, but I like that he gave stories about individuals, and also gave statistics on a group of different nations as well. And I thought he was reading a little bit too much. He looked up though, and when he looked up, he looked at that side and this side, so it was pretty much even. And I thought it was interesting.
Okay. The structural stuff is pretty solid, although I'm not sure that the examples should be their own separate point. It seems like they ought to be integrated into the argument a little bit more effectively. Your claim on the first point concerning the cutthroat nature, the business nature of saving money, I think you had a good example or quote there from the one person who was in charge of that and made that decision, that piece of testimony that you talked about that's available on YouTube. That's pretty effective. It's suggesting that there are cost considerations being made. I don't know how we measure any of those kinds of things. Like you say, it's $500,000 they would have paid. I don't know what the situation was on saving the person's life. I'm not one to sit and judge how much somebody's life is worth. I just know that if they told me it was $10,000 to save my dog's life, I love my dog to pieces, but I had a hard time coming up with the $10,000 so making choices is always tough. I thought that the 2 examples that you're trying to use from the movie, I'm not sure what point you're trying to make with them. The second one, where you talked about the price of the medication, I guess that makes a little bit of sense if your argument is that our healthcare costs are excessive, and there's an illustration of that, then that's what you ought to be saying. But I didn't really get that from what you're presenting. So I think you've got some good information in the speech, but it needs to be put together a little bit more thoroughly, Gesundheit, from an argumentative perspective. I know you're trying to get an emotional reaction on some of these things, but it has to fit together a little stronger. In the last part of the speech, you do have some argument that deals with longevity and the amount of money that we're spending, and I think that that needed to be expanded a little bit, although I do think there's some cause-effect arguments that are problematic there. You're on the right track with that. I'm rushing a little bit trying to get this all on one take. We'll see if it happens, if I have to stop it. The delivery is problematic. You need to project your voice more. There needs to be more variety. You're doing way too much reading, and because you got the script in your hand, none of the presentation stuff is where we want it to be at this point in the term. All right. Thank you.